Good afternoon, and welcome to the July 9th meeting of the Budget Committee. And so we have fortunately, a somewhat smaller agenda, hopefully, than we had the last 2 months. So we're going to begin our meeting today with HD1 for the Health Department. And I see we have Caroline Baisley here, and this is approval to use grants of $175,000. And actually, Caroline, if you don't mind, if you could just slide that table down a little bit this way. Yeah. Perfect. Thank you.
Hope everybody's keeping nice and cool.
Caroline, would you just introduce both of your other people with us?
Oh, yes. Next to me is the operations coordinator, administrator, Deb Edwards. I got a couple of Debs in the office. And the business office manager. Introduce yourself.
Matt Angelino.
Matt.
Matt, what?
Angelito.
Could you spell that for us?
Yeah, E is in Edward, N is in Nancy, G is in girl, E is in Edward, N is in Nancy, I is in Igloo, T is in Tom, O is in Oscar.
Very impressed.
It's a tough one, I'm sorry.
This grant is late coming as usual, and it's an unusual grant as it is. It's the last grant of the COVID-19 funding. We had received several grants over the last probably year or two that were COVID-19 related, and this one was been prompted after the pandemic. They looked at public health, the structure of public health in its entirety across the United States, their response, and et cetera, et cetera. And this funding was given to all public health departments, not only at the state level, but the local level throughout the United States. And this is our allocation. The purpose of this particular grant was to provide for the staff an opportunity to learn about things that perhaps they should have been more conscious of during the pandemic. In other words, there's a lot of training opportunities, and you know, the menu for this particular grant was quite wide, but most of us tried to pick something that we know that would prompt a fee. You know, a lot of the CEUs that the professional staff get, we have free education. So some of these it was hard to think of what we could actually spend the grant on. And one in particular, also I'm trying to get for $175,000, I'm trying to get someone to coordinate this grant because it's all about making arrangements for the various divisions within the, professionals within the division to learn. Like, for example, we have here the subcontractor will offer de-stressing methods for the workforce. De-stressing, I say, like, for example, a lot of health departments chose like yoga, and I'm thinking, we'd have to be in a room like this to do yoga or chair yoga or meditating. I mean, it's quite unusual, but the whole thing was to learn how to de-stress while you're under pressure, because a lot of the public health leaders and staff during the pandemic actually left their posts. In fact, we did have one of our staff under great deal of pressure actually quit on site during the pandemic, and that was not only a horrible thing to go through, but it also was very devastating for the rest of the staff. The other thing is to get some training on how to eat well. We preach this all the time, exercise, eat well, but so we're thinking maybe a registered dietitian to come in and give us some nutritional classes. Other really important training would be communication. Communication during a crisis is paramount, and sometimes you just can't think about how things are going. And I'm sitting behind, who's sitting behind me is the former town administrator, Ben Bramman. And during the COVID-19 pandemic, there was no one better than communicating with the staff's head programmer in town. He coordinated, he was like the incident commander that had us all together and kept us all kind of working in sync so that we would be able to deliver whatever kind of services we needed to deliver on a timely basis, because we were all affected. And he, kept this up for, over a year, and it's something that I personally could not do and help the community at it. So communication is very, very important during that, not only with your team department heads, but also to the public. And he did excellent on that. And we all thanked him very much so. Team building is important. I mean, I can't begin to tell you during a crisis how team building is so important, the components thereof, because you just forget about all that. You really do. So this is all, and I have a lot of new staff in the department. Also things of emergency preparedness training, because we have a lot of people, new people, they need to go have training programs, like Emergency Preparedness 101, 102. So it really, for some, is an introduction to preparedness, and for others, it's just a repeat. Also, the tuition payments, these are items that I know that we can pay for, like Excel training, for the administrative staff that needs to help us during, any kind of emergency, medical insurance building. Certainly, that comes into play not only for an everyday program for us, but it also trains us to make sure that we put aside all of the information needed so that we can get federally funded. And we work with, the finance department and on those programs that we can actually get funded on. HIPAA training, I think we all need a little refresher in that. The staff opportunity for language, I think, is going to be a hard one. We have quite a number of staff who speak different languages, but we also have a registry. There is issues with trying to provide for language communication. And so during the COVID-19, we did run into that. But I noticed that what we may have been lacking was putting information out in different languages. And I think that that's important. We try to do it, but during a crisis, I think it's important to be able to do that. Public speaking, very important. And then any kind of peer groups or non-credited programs that the different professionals of our program can pick up, not only for nurses, but we also have laboratorians that need to go to their conferences and things of that nature. It's an opportunity this is a grant that we would not have if it wasn't for the federal funding, because this is something that, we don't usually fund through the town. Definitely not. And then traveling expenses to conferences. We picked 2 conferences because it gives you an opportunity to learn all about public health in its entirety. And these were the 2 ones that were picked by most health departments. They're kind of costly to go to, and I'm going to try to pick ones within the 2 years of this particular grant to be close to Connecticut. I'm not be sending anybody to California or something like that. But usually if they're in Boston or, down in DC, Philadelphia, it's not that difficult or that expensive to go to, but it's like a 3 or 4 day conference. So this is a one-shot operation. We will not be getting this grant again, and all funds that are not spent go back to the state or federal government.
Thank you. Thank you for the detailed explanation. Leslie?
Yeah, I just wanted to ask, the specific areas and what's included in this submission for us, are you limited to spend the money in the ways that you've allocated, or are you allowed to adjust as over the next 3 years or so your needs change?
There is an opportunity to adjust, but you have to stay within for example, the yoga thing. Yoga's down we put yoga down, not realizing, but if I wanted to do meditating, they would allow that. It all depends on what I want to use it for. If I'm going to turn around and say, okay, I want to liquidate these areas and I want to turn it into the coordinator of the program, that would require necessary paperwork and a change, and it's not worth it, because it's very
But in
convoluted.
individual training, so let's say you needed more Excel training and less something else training that's on here, the public speaking, but that you can modify.
There's a couple of DPH, Department of Public Health, staff members that work with the health departments, so it all depends on whether or not it's going to be a formal request. Again, this is a very unusual thing, but my experience with managing state and federal grants is that they don't let you to go out of the box too much.
Okay. And then when it comes to this kind of training, certainly, where there are materials or other information that could be useful to either your department members that aren't part of that training, or even the rest of the town that might be able to benefit from those. I think it's good to keep copies of those, distribute them, or make them available
Absolutely.
to elsewhere in the town
I
staff.
think, yeah, we tried to do that now, but definitely the training, the HIPAA training,
Yeah, if it can be
HIPAA training I
leveraged,
want
it's
everybody to go through, actually. And the public health emergency preparedness training, that should be all up online. I'm going to try to get people to come in and do like a classroom, because I think they learn more than having it up on the screen on a Zoom. They're writing reports and they're not paying attention, so I'm going to try that to the best of my capability.
All right,
but
thank you.
Interesting.
So this is great. Any more questions? So, motion?
I'll make a motion to approve the recommend approval of the use of the grant for $175,099.
I'll second that and suggest routine.
So Leslie Moriarty made a motion, seconded by Harry Fisher, to approve $175,000 grant for the health department. Those in favor? 400, and that motion passed. Carried.
Thank
you very much.
Thank you.
So I don't think you need to come back on Monday, or Tuesday morning. We are meeting at 9 o'clock Tuesday morning.
See you again. It's a routine item, so we don't need you on Tuesday.
So enjoy your summer. Okay, so our next item is actually our own department, Finance, FI1, for finance for $55,000, and it is a transfer. I think, is this a year-end transfer that we have?
Yeah, I'll speak to the transfer. It is called bank fees, and traditionally, this account, which was a lot smaller, it's budgeted at $270,000 for this year. It used to be exclusively for bank fees and a small number of credit card charges that were part of the finance department. A number of years ago, we worked with the town administrator, and we centralized the charging of the credit card fees. And it became more and more popular, and each year it continued to grow, and which means the expenses increased each year. As I said, we're at 270. We're asking for a $55,000 transfer. From our salary accounts, we've got surpluses in the salary accounts because we've had a number of vacancies, 3 of them in the accounts payable section alone. So it's basically to cover the increase in the credit card usage townwide, including Board of Education.
Can you give us any feel for what the credit card fees were of this now
You don't know, Jay.
$325,000? Do you have any idea?
Tasha had a nice schedule.
Y-
One of the biggest increases was the Board of Ed, in this past year, used they accepted credit cards for pre-K. And that was a significant increase out of the total. And then it's just an increase in usage across the board, Parks and Rec, everybody.
And Roland, do these departments charge a fee for use of the credit card?
It's supposed to be built into the fee that they charge for the service.
Sometimes they charge, if you pay by credit card, you pay an extra.
No, not in this way. This is just like going to a merchant and buying something.
So maybe this is something we need to think about in our budget process.
Yeah, it's a budget question.
So wait a minute, you're saying that not every department charges the 2.5%?
Using the credit cards.
They all do.
We have agreements with the credit card companies, depending on which card it is, but they're negotiated rates, and
Okay.
everybody has to pay the same amount.
They don't always pass it through.
Who they?
If I understood you correctly, the departments, sometimes like the tax collector, you can see the 2.5% or whatever the percentage is when you try to pay your taxes using a credit card. But you're saying not all departments
No.
charge the resident or the,
Nobody does.
nobody
No,
charges.
it's going to be just like walking into, charging something on Amazon for $10, you're paying $10, and there's no
No,
separate fee.
I
Think it's
want
built
to
into
correct
the
you
price.
because I think the tax collector charges and you pay. And also I can tell you that the parking department charges you and you pay the additional.
But
Yeah, but that's not what he's saying, Leslie. He's saying not all of them do. You're picking out single
the tax,
departments.
we can't give up 2.5% on tax revenues. Nobody does. So that's why there's a
But we
separate
shouldn't
fee
give
for
up
that.
2.5% on anything.
But
I thought what was said by Roland was that they're supposed to build it into their.
It's supposed to be built into the fee.
so we have two
It's cost of
people,
doing business.
we have two people here from the Board of Education. And so I'm not going to put Ben on the spot, but I might put Patrick on. Do you know, Patrick, if we're charging additional money, especially since this is the payment for pre-K, which seems like the tuition there would be a good amount of money. Are we charging through, in addition to the cost of tuition, the additional cost for the credit card fees? Uh-oh, we have Mr. Branyan returning in his new role, his first public appearance in the Budget Committee in this new role. And we miss you in your old role.
And I'm going to speak to my time in my old role. Just a quick reminder, this credit card issue was because of the cash handling task force. There's a recommendation to increase customer service, but also to eliminate cash and the transaction associated with both cash and checks. The issue you're talking about is there's 3 different platforms. Tax collector uses a platform that collects a convenience or conveyance fee or a courtesy fee, however you want to look at it, for the use of paying it. Parking Services uses another vendor, and I think the issue that finance is talking about is the town's credit card processing. So when you say other departments are collecting a fee, that's the platform. So Parking Services and the tax collector are 2 different platforms. Everything else is used through a consolidated credit card processing fee. And from the Board of Ed perspective, we're happy to look at and make sure if we are correct in using credit card that we build in the convenience fee as part of the overall fee.
Okay, so I think that you can look ahead because I think we'll have it as part of our budget guidelines, right, David?
Yeah.
Didn't we, just an add-on, we increased that line item from 270 to 300 for the current year.
So, and the number you have total now is 325,000, so probably-
It looks like we might be short at this pace.
Anyway.
Just to follow up, did you want to break down, Natasha spends a lot of time tracking the bank fees versus the credit card fees.
I mean, if you have a breakdown, I'm sure that.
We can
you
get
know,
it to the full BET.
Ben,
That would be good.
is there some reason why we don't have one provider for the entire town?
It's my understanding each has a different platform. So the tax collector, I think, predated almost everyone, maybe besides Parking Services, in the platform they use to pay taxes. Parking Services, because of their permit and the ticket issue, there's already various vendors out there that they used it. All the other issues we use as Roland mentioned, you're just walking into the merchant, whether or not it's Parking Services or the tax assessor or others, they just swipe the card. That's been consolidated. But that's why there's just I really say there's three different business cases. Tax collector already has a platform that a variety of municipalities use. Parking services is a niche service, and the balance is just, Parks and Rec fees and the like. They've done a great job consolidating. And the last piece I'll mention is, before we did the consolidation, you had a negative incentive. The departments simply weren't offering the service for a credit card because it hit their bottom line. With the consolidation, you've also provided, I think, better customer service to the taxpayer and the end user.
No, I acknowledge it's better to have the facility. I just am concerned that we ought to be collecting the fee in every instance.
We definitely should review the fees, make sure the overall fee includes that transaction cost.
Maybe the finance department or perhaps the treasurer could address this townwide.
As an example, I think it's really becoming, a wider, use of credit cards is to charge the extra money. I know at the Greenwich Symphony, we charge a courtesy fee to use credit cards, et cetera, but especially it seems to me on the larger items such as pre-K tuition, that would be something that we should charge the user, make sure.
And my understanding was that we
Karen should use a mic.
Is that correct?
Yeah, that's my understanding. Treasury worked with picking the best vendor for the lowest. But we've also learned, it depends on the card you carry. And whether or not it's air miles or whatever type of rewards, they each have a different transaction fee.
Anyway, thank you very much. And do I have a motion, or do I have any more questions?
I move that we approve FI 1, and I leave it to the chair, but would suggest it be routine.
I'll second that and suggest routine.
Okay, so moved by David Weisbrod, seconded by Harry Fisher, to approve the transfer of $55,000 in the Finance Department. Those in favor? So that has passed unanimously. And so we're not going to let Pete and Roland get away with not coming to the full BEP meeting now.
Now, that's a good point.
But you don't have to bring this transaction. You've got the controller's report, et cetera. Okay, so that's 400. Okay, so our next item is FD1 for the fire department. It's $6,315 and it's a transfer. And Roland, are you going to handle this?
Yes. This is a transfer into the volunteer healthcare account. It's the only major object code in the 700s in the fire department, and they're just a little bit short to cover the insurance premiums for the volunteers. So this is just a transfer to cover the last payment.
Okay. Any questions?
No, but I'll make a motion.
Okay.
Motion is to approve, to recommend approval of the transfer of $6,315 for the fire department.
I'll second that and suggest routine.
Okay. So motion made by Leslie Moriarty, seconded by Harry Fisher, to approve the internal transfer in the fire department for health insurance for the volunteers as a routine item. Those in favor? Aye. So that has passed unanimously. So Roland, you can tell the fire department. So we have moved quickly to Nathaniel Witherall, and we have with us this month, as last month, John Mastronardi and our own Joan Lynch, who are sharing with Nathaniel Witherall. And this is Joan's first appearance back before the Budget Committee in her new role, but she's sharing some time with her old role with Nathaniel Witherall. So she's our new Assistant Controller in the Finance Department. So we're thrilled to have Joan with us, but also in her other role today, because I'm sure, John, you continue to need her assistance at this point.
And I appreciate the sharing of the time. I do. So thank you. As you know, I am John Mastronardi, the Executive Director of TNW. As you also know, the Board of Estimate and Taxation conditioned the release of 10% of 2024 and 2025 Nathaniel Witherall budget on the submission and approval of a plan for the facility to achieve break-even by the end of calendar year 2024. Break-even was defined by the BET as being measured prior to debt service and capital. I will note, however, that there are other sources of funds being developed by the Witherall Board to support capital spending, including a revitalized Friends organization and additional state and federal funding opportunities. As the individual who is responsible for managing the daily operations of the facility, I want to first state to you all that I believe that the facility is capable of achieving break-even by employing certain measures that I will outline for you here. I am committed to doing so, subject to the decisions that the Witherall Board may make and the direction that they may give me from time to time. The strategy that the facility has been pursuing remains the same as what was developed over the past year. It has 3 elements: restoring the ability to measure and report financial results, and doing so on a true accrual basis, generating meaningful and actionable insights for management. Treating in place, it is fundamental to quality of care and the quality of our life of our residents. And lastly, being the best possible partner to our principal referral sources, which means admitting more clinically complex cases. As a result of pursuing these 3 elements of our strategy, the tools are now in place that provide me and my management team with the ability to execute and move toward break-even. There are 5 levers that determine whether we are at break-even. Management has the ability to trigger certain levers, and while others are key drivers of financial outcomes, we have little or no ability to impact what happens with these other levers, which I will address in more detail shortly. I will provide a narrative explanation and afterward provide the dollar amounts associated with each. The 5 levers and our ability to impact them are: 1, census. The facility has been living between the 160s and the low 180s since the beginning of the year. As of today, the census is 174. And next year's budget is built with an average daily census of 184. The tools are in place to succeed on achieving that 184 daily census, with increasing nursing skills and capabilities, and with the presence of a liaison at both Stanford and Greenwich hospitals, our primary referral sources on a daily basis. In many ways, this is the most complex of the 5 levers, as we are competing with other facilities for the same admissions. And the degree to which the facility can consistently maintain a higher average daily census reduces the pressure to fully employ the other levers. To that end, our admissions liaison, Nancy Marshall, maintains a consistent daily schedule of traveling to Stanford every morning and Greenwich every afternoon. Nancy checks on any of our residents in the hospitals, asking about their status and pending return to Nathaniel Witherall. She also continues to promote good working relationships with the discharge planners and case managers at both hospitals, asking what they need help with to hospital discharges and how we can be the best possible partner. Continuing to focus on that theme of being a good partner, our leadership team has met with Stanford Hospital's management and asked directly what some of the hospital's most pressing needs from the skilled nursing partners were, to which they replied, a strong COPD program. That information was shared with our medical director, Dr. DiTeodoro, who set up and attended a meeting with me and 2 of his colleagues, who are pulmonologists, to begin to map out a strategy for developing a COPD program in which a Stanford pulmonologist would be on site at our facility once a week, working in tandem with our respiratory therapist to treat more advanced respiratory cases that we currently turn away because we don't have the clinical expertise to care for them. This achieves 4 primary goals. First one, it prepares a service that one of our primary partners wants and needs. 2, it gives us the ability and surety to admit patients we would not have been able to admit before. 3, once admitted, it gives us the clinical strength to treat residents in place who had previously been discharged to the hospital because we didn't have the clinical skills to care for them in-house, thus helping to achieve one of our logistic and strategic goals of reducing our hospital readmissions. And lastly, it gives us a program of distinction that distinguishes us from our peers. We intend to have similar meetings with Greenwich Hospital and aim to follow our developing COPD program with additional clinical programs such as the development of a cardiac program and the exploration of a hospice program based on feedback from our partners. The second lever is non-direct and direct care staffing. Non-direct care staffing, reductions in these areas would be difficult but could potentially be implemented with less of an impact on our residents. In a public meeting, I'm not prepared to detail these potential changes, but happy to talk about them privately. Direct care staffing. The facility has been both budgeting and actually operating at 5-star staffing levels. This would be the most unpleasant lever to pull in order to get to break even, as it would at a minimum certainly impact quality of life and resident and family satisfaction, not to mention staff satisfaction. But nursing homes have the majority of their costs in labor, and the majority of labor costs are in direct care. Any decision to reduce staffing levels below 5-star standards would clearly be dealt with as a board-level decision, and it could affect our overall star rating. Reducing below 3 stars would be counterproductive financially, as an increasing number of payers will not approve admissions to a facility that is less than 3 stars, and I expect that trend to continue. We additionally must continue the progress we have made in adhering to the staffing matrix, which we now use, based upon census and the acuity of our residents. 3, management of overtime expenses. To that end, in an effort to reduce overtime costs, the process by which overtime is approved at Nathaniel Witherall has changed as of June 21st. This process will maintain a strong emphasis on department head and leadership oversight. All overtime requests must be first reviewed and approved by department heads, supervisors, and patient care coordinators, and submitted for final approval to administration. Nursing overtime must be submitted for final approval to the Director of Nursing and the Executive Director. Payment for overtime will be contingent upon prior approval. Nurse supervisors will be first-line overtime managers. At the beginning of the morning shift, supervisors and/or PCCs will go to each floor to confirm that nurses and CNAs who have worked overnight are punching out at their scheduled times. Part-time supervisors will be reminded prior to their shifts about how strictly we are following the staffing matrix. There is a copy of the matrix in the nursing supervisor's office. So evening supervisors from 3:30 p.m. to 11:30 p.m. at the beginning of the new shift, those evening supervisors will ensure morning shift nurses and CNAs are punching out at their scheduled times. Night supervisors, which is the shift from 11:30 p.m. to 7:30 a.m. at the beginning of the new shift, the night supervisor will ensure evening nurses and CNAs are punching out at their scheduled times. The fourth lever, Medicaid rates. And Medicaid rates, I apologize. The Medicaid rate is expected to increase effective July 1st due to the lifting of post-COVID limits on reimbursement rates. Based on our communications with DSS, the estimated increase in the daily reimbursement rate will be approximately $50 per day. We will not be notified by DSS of the exact new rate until mid-August. The fifth is Medicare rates. There are 2 elements to this lever. The federal government resets rates effective every October, and we have no control over this element of the Medicare rate. But we expect a Medicare rate increase of just under 4% in October 2024. Our MDS process is the second part of this lever, and improved documentation of the clinical condition and the needs of our residents is an aspect of our average Medicare rate. And we believe we have a great deal of opportunity to improve in this area and to consequently improve our reimbursement for the care we are giving to our short-term residents. The MDS process is tied to Medicare rates as well. An MDS assessment, also called minimum data set assessment, is a comprehensive review process conducted on residents in nursing homes. It gathers information on a resident's health status across various aspects. The MDS assessment helps create a personalized care plan for each resident. It also plays a role in determining Medicare and Medicaid reimbursement for nursing homes. On Thursday, May 30th, Joe Tomeno of Grassi Healthcare Associates interviewed all staff who are responsible for various components of the resident assessment process at the facility for the purposes of identifying opportunities for improvement. These interviews included the following disciplines: the MDS department, nursing, dietary, rehab, social work, and therapeutic recreation. Mr. Tomeno issued a report on Thursday, June 20th, and as it relates to the accurate coding and the reimbursement revenue associated with it, the following recommendations are pertinent. Triple check background. In skilled nursing facilities, the billing triple check process is a vital internal audit that ensures accuracy and compliance with regulations before submitting claims to Medicare and other payers. It's a team effort involving various departments working together as a check and balance for resident billing. The benefits of a strong triple check process include reducing claim denials and ensuring proper reimbursement, minimizing risk of audits and potential penalties, improving documentation accuracy and care quality, and promoting better communication and collaboration among departments. By implementing a well-defined triple check process, the facility can ensure accurate billing, regulatory compliance, and ultimately optimal care for our residents. Getting a triple check done on a timely basis ensures that our reimbursement revenue is optimized and our cash flow and monthly revenue cycles are consistent. The summary page of this presentation includes the potential annual value of improving our MDS process based upon the June 20th, 2024 Grassi Healthcare Report. Management of the facility has been asked to focus on what is in our control related to these 5 levers: non-direct care staffing, direct care staffing, Medicaid rates and Medicare rates, monitoring the ones we do not have control over, and reporting back to the board in August on how hard we have already pulled on levers and how much harder we have to pull on those levers that we do have control over to break even. The 5 levers I've outlined above give our management team the ability to achieve break even as you have defined it. And I again want to assert that I am comfortable that we can get there by the end of calendar year 2024. Thank you. Thank you. Oh, sure, okay. Yes,
Sure, what was-
certainly.
If you had more to cover, or
Well,
are
we
you
can
going to go over the
We
sheet?
can go through the summary sheet. Sure.
Or do we just
Or
have
if you have
questions?
questions.
Does anyone have any questions on what John has said so far? Harry?
No, on
Leslie?
the sheet itself, though.
Well, let's first, cover any questions on what he said already.
No.
Leslie?
Just to put all that information in context, and thank you so much for presenting it as clearly as you did. How much is a different approach than what Nathaniel Witherell has been trying to do for the past 6 months or a year?
In very plain vanilla and unglamorous terms, we have not had a process in place, for example, for overtime management. And that has been a moving target for us, but I feel confident now that we can actually, if we can cut $10,000 from each pay period overtime, that's a significant savings for us. And I'm confident that we can do that. We've got the process in place now to do that. That potentially could save us anywhere conservatively from $200,000 to $300,000. That's something that we simply haven't focused on up until now. And I think that as far as the other levers are concerned, I'm willing to make necessary cuts if I have to, and in the order that I've talked about. And that is also different. If we have any challenges getting to a higher census, then Clearly, non-clinical staff would be the first that I would look at, and I've already reviewed them. I have the staff positions in mind that would cause the least amount of consternation and problems for our residents and our staff, but they would make a significant impact into the bottom line if I had to do that.
But the turnaround essentially is subject really to the census, and more census and, I guess, patient mix to some degree. But that's where your focus is, to improve your ability to address their needs and your ability to identify those people and get them in your facility.
Yes, so the COPD program that we're talking about developing, that will take a bit of time, but as I said, I've met with the doctors about 2 weeks ago, and I'm ready to move ahead with that. And those will be patients that Stanford needs to discharge from the hospital that are costing them money, and quite frankly, that we can't take care of right now because we don't have pulmonologists on staff. This will give us the pulmonologist once a week. We'll be able to take those patients. I would suspect, and this is anecdotal, but I would suspect we would be able to take at least 2 or 3 additional admissions a week that we wouldn't have been able to take before. And those are higher paying admissions because it's higher acuity care.
And as you go forward in developing, you've got the plan, you have your objectives, there's going to be ebbs and flows, but have you been able to, or can you identify success criteria along the way, so you can identify whether you're on path to where you need to be, or what adjustments you may need to take along the way, so that it's not just a beginning and an end point?
Yes, we will have to measure against our actual goals, and to that point, we can do that with overtime because we can absolutely trend that. We can also trend the higher acuity payer mix cases, and we can do that on a weekly and monthly basis to make sure that we're actually hitting our goals, and then we can present back, as a matter of fact, right, our census. It will be obvious how and why our census went up.
Harry, do you have any questions?
Yeah, I'm looking at the sheet that was handed around to us. You're saying the estimated.
Harry, can I just ask, were you planning to talk to the sheet first before? I mean, I did ask initially that we cover all the questions,
Okay.
Just went through it, that's what it's verbal.
Okay.
So we tried to do is summarize and quantify so that it will be measurable going forward. So it's the same points, but the 5 levers are above, and then the staffing that is not quantified because that is not a change that has been made. That's an option that's out there if and when needed. So we can walk through it, but it's really assigning values to those 5 points.
Okay, thank you. So I'm sorry, Harry, I just want to make sure that if they had
Right,
any kind of
understood.
introduction to it.
You're saying the estimated fiscal '24 loss before debt and capital is 2.9 million, but there have been higher numbers that have been talked about, north of 5. Can you reconcile?
This 2.9 million, we've been estimating that since about February as the loss before debt and capital. So the other amounts that you're thinking of probably include debt and/or capital.
So may I ask along the same line? Harry, can I ask?
Yeah, please.
Okay. So I guess maybe Roland. When we look at the economic report, and I don't think we have one this month, is that, it's too early, right? When we're looking at those numbers, and if we take the revenues and the expenses, are those numbers not inclusive of charges for debt and capital? Those are operating numbers, correct? Is that what we're seeing when we see those numbers? Or can you just explain, because I like to understand what you're saying versus
Yeah, I want
the
to go back
numbers.
and look at numbers better.
That's the total expenditures of Nathaniel Witherall.
So that includes
that will include
capital,
debt and capital spending, yes.
debt and capital.
Yeah, I
So,
have this.
so then what we need, so I think this is a good point, that we're looking at, we've set up a condition which has numbers, using numbers that are different than the numbers that we see on Witherall on a monthly basis, is what you're telling us now. So we probably just need to have, at least as we track this, I assume this will be certainly for the remainder of the year and probably into all of fiscal year '25, we probably need to have an asterisk and an adjustment for whatever the expense number is without capital and without debt, right? Harry, is that right? Before debt and capital, so that we can understand it better. So we did a condition that is different than the condition for the numbers that we see on a monthly basis, or that we have to account for when we look retroactively at our loss, which is based on our audited financial statements. So the next time we need to think about how we would handle this a little differently, because it is a little confusing to us. So,
Yeah.
I'm sorry?
Karen's got a question.
I know, I did, but the question is,
No, but
were
my,
you finished with
Yeah,
your?
no, I think you're right. We need to delve into the numbers a little more to really understand what's going on here, because
So if I,
Wait, let Harry finish. Are you finished?
yes. thank
He's
you.
finished now. Now we have David, and then we'll have Karen.
right, so I see Joan scrambling around giving out some template, or I don't have it in front of me, but I suspect that it may address the question that is being asked. So as my colleagues know, I have to step out for another meeting at 2 o'clock. I may be able to come back to this, but I do need to step out. I would say, in the event that I miss some of the discussion, that I do think this is an excellent first start. I would ask whether you are planning to appear before the Budget Committee monthly to beef up this input, update us as you get responses from Medicare, Medicaid, as you've indicated, maybe coming in the middle of the summer. Are you able to commit that you'll come before this Budget Committee monthly to review all this?
Can we add, if the Budget Committee wants to see them monthly?
Right,
Yeah, at the Budget Committee's request, yes.
at the Budget Committee's request. I mean, so, yes, so that's good. I do think that the points raised by Harry are fair, and I think that you acknowledge that by virtue of what I'm watching Joan hand out, and that is that we need to translate this into a template that, I don't think the numbers are different, but the template has to match the prior pre-debt, pre-capital requirement that was set forth in the conditions. So we all agree on that. Those are the only comments I wanted to make.
Good. So, just, this is a comment, it's not a question. John, you've had a very good presentation, which obviously is all written down. Are you planning to give us a copy of that or email this to Roland so he can
Yes.
circulate it
Of
for our
course.
next meeting?
Yes.
And Joan, did you hand out anything different to Harry than was given to the rest of us? And if you did, can you also, both this paper which you've given us and then anything else you've handed out, please email to Roland so that Roland can distribute to the BET, full BET?
Yes, both documents were distributed as part of the May board meeting for the Nathaniel Witherall. So they are already distributed, but I will send around.
So we normally don't get this, and this is actually something that I would like to request. In the past, the full BET was sent the Witherall package, And the monthly board package, do you have monthly board meetings, or how many times a year do you have them?
Well, we have 8, but we have 12 finance committee meetings. So we have a package every month. It's been going to Harry, Stephen, and David.
So while I do respect all of those people, I do think that this is it used to be that we all got these packages, whether we served as a liaison, which I did for some years, or we didn't serve as a liaison. And I do think that this is important enough now that it would be constructive if the board package, at least for the remainder of the year, either the board package or the monthly financial, whichever is available, be distributed to the full B. So when I say that, just send it to Roland, and Roland will.
I think that if the chair gets copies of it, he should just distribute it, and instead of, relying on Witherell, I mean, it should be distributed from the chair to the full BET.
Well, that works fine. I just, it used to be Linda would just send it out to,
Or the liaison,
you know,
whoever does it first.
Mr. Phelps.
I just want to say, I can certainly appreciate that, and we also get the information. Trust me, you're going to be much more interested in the financial results than the full board package.
Fine, but at least
Well,
everybody's on the same page.
Right. No, I mean, I can tell you that I've received the board package a very spotty basis. I always read everything in it, and I think we all learn something from this information. I think it's, this is the town's second largest department, second only to the Board of Education. And so, sort of as it goes, so do we all go. So it's important, and I think at least in this period of learning and transition, that we all receive this data. And I do respect our liaisons, Mr. Selps and Mr. Alfano, and, I know that they're doing a good job too, but I think it also would be, and also, I'm going to add, if there are interesting exhibits that are handed out in the board meeting to the membership, if those also could be distributed. I think there were a couple things that were handed out at the last board meeting. I was there together with Mr. Selps and Mr. Fisher, and, it was a worthwhile event. And that's another thing. These are public meetings, and any member of the BET can also attend these meetings. So I know, Ms. Fasciolotis, you had another.
Can she speak into a
You're
mic?
basing,
I think, do you need a microphone?
okay, you're basing a lot of these assumptions on a 184 census. Did you consider at all reducing the census and reducing the staffing instead of the model that you're presenting, which would require reducing to reducing staff to 5-star to reduce expenses? And if not, why not? If so, why was it rejected?
Well, to answer your first question, yes, we did consider it, and it is going to be a contingency plan based on the possibility that if we don't achieve a census of 184 consistently, then, as I said, we would start to pull on those levers, and that would include reducing staff, clinical, non-clinical first, and then clinical if we had to.
But you would still be maintaining a 5-star based on the reduced sentence, would you not? I mean, again, census, I'm sorry. Again, the object is to be profitable, so if you have to reduce your census and concurrent staff to become profitable, why would you not consider that as part of the business plan going forward? Because it seems to me as though there's, you're setting up a program, for example, the COPD program, which is higher risk, higher liability potentially for the town, based on feedback from a hospital. And yes, it would probably give us, a market advantage because other facilities don't have it. But did you weigh the risk benefit to the town in terms of potential liability versus income? Because one bad case can ruin us. I'm just trying to understand the factors that were considered, and why that wasn't, if it wasn't discussed more rigorously, why a reduced facility wasn't discussed to become more profitable.
It has been discussed, but our first and foremost preference is to increase the census. That would be ideal. The last thing that we would really want to do is go below five-star staffing, but it's certainly not off the table. It is on the table. It's just that we want to follow this order in preference to increase the census. And, as far as risk is concerned, of course, I haven't signed any contracts with the Stanford pulmonologists, but the legal and risk management would also be involved with that. I would be talking with them and getting their feedback. So, but yeah, all of this is on the table. It is just first and foremost, we'd like to increase our census and see if that gets us where we want to go.
Before Joan pipes in, I'm just looking at it more from a, I don't want to reduce below five-star staffing, but is there a way to achieve the five-star staffing with a reduced, with a reduced census that would maybe necessitate closing a wing or closing something that, that reduces the expenses of the facility?
So to address your first point, Karen, the majority of the costs are fixed. So the additional census absorbs the fixed costs. And while we say we can adjust staffing of the clinical direct care staff, that is mostly CNAs because we have 6 wings, and each one for all 3 shifts needs to have, so, and then logistically closing one of those wings would be logistically very difficult, and the board has, specifically the chair, has said that would spiral downward, and that would also take years because people live there, so you can't easily move them. But getting the census up absorbs the fixed costs, and the incremental variable costs are basically CNAs. There are some LPN and RN, but not a lot. So that's why increasing the census is always the first and foremost way
Well,
to get there.
obviously, we want to increase census, but I'm saying if you can't achieve that, and it seems as though that, you're averaging right now at 174, you're down to the 160s, are we really stretching it at 184? I don't know at this point. But, to me, again, I understand the fixed costs, but there's got to be a way of reducing census or reducing a wing, for example, and just closing off a wing if that's necessary to reduce your costs, and in the rotation. And, I'm sure that if people were offered another room or another place within the facility, you need to talk about it. But I just don't want to see reject that out of hand, because I don't like hearing that, oh my gosh, if we don't get the census, we're going to have to reduce staff and reduce to 5-star, when there could be potentially other solutions to this. Because that doesn't bode well for Witherell, if you're saying, well, we're going to reduce lower to 5-star, then you get all the outrage and all the rest of it, and, and nothing gets accomplished. We obviously, are committed to Witherell at this point in time, but I don't want to see rejected other potential solutions out of hand because somebody decides that, it will spiral downward if we close a wing. Or it's not logistically possible, when we all know that it could be logistically possible.
Leslie?
So I just wanted to comment on 2 of the things Ms. Fasilios just said. First, you talked about the goal of Nathaniel Witherell is to be profitable, and I don't believe that that's the goal that's inherent in our condition, nor has that been a decision of this BET. I think there's a role in the town which had gone on for many years with some level of willingness for financial support don't know what that is now, but I just want to go on record saying that I noted what you said, and I don't know that that has not yet been voted on as the goal. Secondly, as far as the alternative on closing a wing, and I think Ms. Lynch talked about it, there are fixed costs and there are variable costs, and patients, even at the Medicaid rate, add financial resources to help cover the fixed costs. And so I think that analysis is there. People are asking for it. People say, well, just close a wing, it's easy to do. One, and I hear it's not easy to do. Secondly, it may not result in the outcome. And there is certainly time going forward to continue to look at that, to refine the analysis, because I think at a top-level analysis, it was determined that it doesn't benefit the ultimate goal. It doesn't get you where you need to go. But, so I'm not, and what you're concerned, I understand your concern. If you lower it to 3-star, have you foregone the opportunity of taking down that path, going down the path of looking at a smaller facility, if that's the right answer? But I think that they can do that analysis as they go.
I'm not going to debate you, Leslie, because a lot of what you said is not exactly what I was getting at. I was getting at to the point is that as you go forward, we need to look at other potential options. I'm not saying it is the option, but if we're not generating the revenue or the census, would it make sense to do what I was suggesting? Again, there's nothing set in stone here. If 184 can be achieved with minimal, risk and liability, I'm all for it. I just worry about the potential downsides going forward, and I think we need to be very cognizant of it, because running a nursing home is a complicated, and we all know it's very complicated. With respect to the amount of loss that the town is willing to absorb, I think that, times have changed, and I think that we need to be cognizant of the fact that, yes, this is a department, it's a department that has been consistently losing money, and consistently losing more money every year than it's been gaining. So, we need to be very cognizant of that fact as well, and we need to start having that conversation again, and talk about it. And where we come out, I have no idea at this point, but I'm just raising that we need to look at these things as we go forward.
Okay, so before we go to Harry next, I would just like to make a comment. And then after Harry, I actually have a couple questions, and then I'll go to Stephen, if that's okay, because usually, Stephen, unless you have to leave? Okay. So the way the condition reads is to release upon, or I'm only going to read the one thing that I think fits with what Leslie and Karen were talking about back and forth. A strategic and operations plan that achieves operating break-even, prior to debt service and capital close, on an accrual forward-looking basis. So it's not a profit, but it is a break-even, and I think we need to be clear on that. And when we talk about break-even for Nathaniel Witherall, and we're using these numbers, we have to understand that there's no allocation for our HR department costs. Probably, again, this is the second largest department in the town, and certainly on the town side, the town's largest department. There's no allocation for purchasing costs. There's no allocation for legal costs. There's no allocation for the finance costs, and so forth and so on. So there's no allocations that are attributable to Witherall for these other costs that other nursing homes in the industry would have. So I want to make that point. The second point I will also make is for many nursing homes, and John would have a better idea of this number, the real estate costs are substantial. And that's why the real estate investment trust industry has so many assisted living or nursing homes, et cetera. That's, in their various and sundry vehicles. So Nathaniel Witherall basically has no operating costs in their budget for their real estate. And this also is critical in terms of, what other costs does it not have that are included in this when we're looking for an operating break even. So I just wanted to pick up what Karen was saying and Leslie as they're back and forth and just add, some of this additional information. Harry, you're next.
Yeah, I want to address Ms. Moriarty's first comment about the losses that the town has tolerated. The town's been forced to tolerate losses. The only deliberative decision that's been made, in my knowledge, is to include in the budget a contribution from general fund that has totaled $500,000 for a few years now. We've been handed losses by Nathaniel Willerell that far exceed that. So to say that there is a discussion or a decision within the town to tolerate larger losses is just not true. The amount of losses that have been suffered by this town over 10, 12 years could have built a school. We all have to be conscious of that. The only active decision, again, was $500,000 in the budget. There's been no other discussion that we should tolerate $3, $4, $5, whatever $1 million.
Can I just respond?
You're going to take my turn? You can decide. No, please respond.
I just want to respond because, Harry, you remember, we used to carry $3 million of a loss in Nathaniel Witherell for so many years, right? And then as their losses were for a few years higher than that, the signal was being spent. First Selectman started it to reduce it at 1.5 million. That it went to 500,000. I know we discussed it at the budget. 500,000, I knew was unrealistic, but it was a signal that the First Selectman put in and the BET majority carried that one through. And we approved this condition. We're asking for a break-even loss before debt and capital. That 500,000 is after debt and capital. So, I don't know what the annual loss that was inherent in there, but it's more than 500,000 on the operating level that we're talking about. But look, we know that this has been a business in the past 5-10 years that has, yes, used more resources of the town than we would have liked. I don't know if that means that there's no support for maintaining it. I don't know that answer among the community. But I was commenting that I don't believe that we're expecting it to be profitable at the.
So,
I don't think anybody's expecting it to be profitable.
so.
Well, all right, Karen is, okay.
Break even, but break even again, as I pointed out, was without a lot of other costs.
Just one more comment. I would point out that this is a business that does survive in the private sector by being profitable. Otherwise, it wouldn't exist.
So, and they've figured out ways to do it is by putting their real estate into real estate investment trusts and so forth, but we don't even have those expenses, okay? So now I'm going to ask my questions before I get to Stephen. My questions are about some additional data that I would like to see. And probably, John?
I'm going to recognize Stephen, I think.
No, I said I was going to recognize me first and then Stephen. I'm asking some questions. The data that I would like to see is, hopefully this is available, for fiscal, just as a base, so we have a comparative base. I would like to see a breakdown of this census of the, whatever the numbers are, 160 to 180, whatever you had said before, for fiscal year '24, broken down by short-term care and long-term care. And for the ease of whatever you want to do it, you can do it by the units in the tower and the rehab units, but just, asterisk how you're doing it so that we can have a comparative basis as we do July of this year, et cetera, et cetera. And if you can, take it back a couple other months prior to that. I'm not asking for a long-term, but, just so we begin to get some kind of a comparative base on that. And again, by short-term and long-term. And then the other thing that, and John knows I've asked this question before, and he's delivered the information before. I would like to see the average number of days of care of the short-term residents and, in one block, and, and the long-term care residents in the other block. Because, to me, well, first, I want to see it. I want to see this data to the, points that some of the points that Karen has brought up. Also, this is the way you begin to allocate costs too. You talk about, adding short-term people or whatever because they make a higher return. However, we're not allocating costs. Are the food costs higher for, the short term than they are long term, et cetera, et cetera. But more importantly, it goes to allocation of staff. So, if you're turning a short-term bed 30 times what you're turning a long-term bed, that means that allocation of those, what you need for admissions is that. Likewise, in terms of the social services for the departures and so forth, it begins, that's the beginning of allocation of costs and the fixed and variable overhead that I can't remember if it was Leslie or I think it was Leslie talking about. But those are the kind of things that to be a profitable nursing home, you have to begin to really understand your costs. And I'll call it a break-even nursing home, to allocate your costs in order to have a better feel for where we go ahead. So that's the additional information that I would like to see to help us better understand the rest of this program as we move ahead. Now I'm going to come to Stephen and just ask Stephen, could you just please have a microphone when you talk?
Thank you, Madam Chairman. I had raised my hand at an earlier point. I just wanted to say, in response to some of the colloquy, I share this board's concerns about the direction of Nathaniel Witherall. And since I became one of the liaisons earlier this year, I've had the opportunity to talk with the chair and also to attend a number of the finance meetings. And one thing I can tell you, and I think Mr. Mastronardi said it very well, in my conversations with the chairman, what he's emphasized to me, and I think it's consistent with what Mr. Mastronardi said, is that he wants to try this plan to both increase the acuity of the patient base, which will drive up revenues, and then to drive up the census. But by the same token, Mr. Markowitz recognizes, at least in his conversation with me, that it's not a perfect plan, meaning its success can't be guaranteed. And to the points that some of you have raised earlier today, he is prepared to look at the other things, including the shutdown of the wings. But at least when I've asked that question, I've gotten the same answer that I heard from Ms. Lynch, which was Brad's view is that you're going to have the same fixed costs and you're just going to have a lower revenue base. But I want to emphasize, his mind is not closed about this. He just believes that the long-term interest of this community is served by trying to get us to break even, and he believes that the plan that Mr. Mastronardi outlined is the best possible plan for that. But there's no question. There's a lot of contingency to that, and I think the questions this board has raised today, go to exactly what the potential risks of that are. So, and I only wanted to say that because I know Mr. Markowitz is not here. On his own, he'd be far more eloquent than I am, but I do want to express his concerns about that.
Any more questions? So, we have several other BET members here, or at least a couple others now. Do you have any more comments or questions yourselves? Just give other BET members a... Elliot? No, Elliot, if you do have something, if you could just use the microphone, please.
I would just like to say that I support Mr. Markowitz's plan. I believe that we should. He has only been in this role now for approximately a year. I believe that we owe it to, the town owes it to itself to give this plan a little longer to work. And if it doesn't work, then we should absolutely reevaluate whether it's, 6 months or a year from now. So I support giving more time to turn things around.
I think Mr. Markowitz has been chair for longer than that, at least a year and a quarter, if not approaching a year and a half. But anyway, your point well taken. Thank you. Any other, Harry?
Yeah, I would just like to suggest that we've gotten a good report today. I'm not necessarily convinced that we've met the condition. I don't think there's a necessity to release the condition anytime quickly. I think, well, Mr. Weisbrod was talking about monthly meetings. I think a quarterly would be appropriate. I think I'd like to see Nathaniel Witherell come back in October with, financials through year-end 24, fiscal year-end 24, and a look at the first quarter of 25, and go from there.
So I do think that we did not receive anything written in advance of this meeting, and that we need, thoughtful consideration as we move ahead. I would agree with you, and I think that it's premature to consider release of conditions at this point in time, which is basically 10% of the budget, and we know that, they can move ahead over the next quarter or two without, that final 10%, which is probably going to happen way out there next year sometime. But I would also, your suggestion, they come back quarterly, I think that that's premature to decide how frequently. But I attended the board meeting with you and Mr. Selps on, I guess there was the June board meeting, and there was discussion that Witherell might return in September. So I think it just depends on how much work they've done between now and then, whether they return in September or October. But I think whichever appears to be the most constructive meeting for this budget committee, the BET board, and Nathaniel Witherell, I think it should be no later than October, and it should be whatever is the most constructive meeting for all parties.
I think October gives us the benefit of a full quarters report, and it's easier to look at that.
Well, I mean, that isn't necessarily true, because right now we don't even have the June numbers, and, just depends on timing.
Can I suggest that this can be determined later?
Yeah, that's what I would say. But
We'll see when
I
the
think that,
information's available, when we need to meet
Right,
again.
that's
But
what I
would-
said.
But I would agree that we are not in a position to make a motion or vote on the condition today.
so we thank John and Joan for joining us today, and we look forward to getting the additional information that's needed, and then also making sure that all board members get the monthly information that's available from now on. Okay?
Thank you.
Thank you. So the next item we had on our agenda was economic conditions.
School lunch.
Oh, my goodness, we did. We've so caught up here. Sorry about this. Is school lunch. And so we welcome Mr. Ben Branyan with the schools this time, rather than seeing him with the town. And so welcome in your new position, your new exalted position. And Patrick Liu, who we see every month now. And so you've come on the school lunch, and so can you help us a bit? We actually have a little confusion in our package. We actually have two items, and we believe that SL1 in our packet for the 175 is probably not the right one, and that we need what is in our packet is SL2, which we might renumber SL1, is the right one to be here, and that's for $54,000.
That's correct.
Is that correct?
Both labeled SL2, blue sheets.
The 175,000 was the estimate, I think maybe last week. And then now, after we look through all the closing.
Can you just make sure that you're a little closer to the microphone, please?
So when we now kind of like look through all the major object code and the budget balance on each of the items, the new request on the table is $54,000 instead of $175,000. So this additional appropriation is to cover the overdrawn on the major object code 100, which is the personnel salaries. So the original estimate was 175 that I just mentioned, but now after we look through all the outstanding invoice, looking through all the encumbrance, we now see the additional appropriation required is $54,000. The additional appropriation will come from the fund balance, and then on the next page, I have an analysis put together and also an update about the May interim budget that we requested, and then wants to give you an update where we are on the May interim budget spending. If you look at the top table, this is, I lay out kind of like our original budget by the major object code. And then the revision is throughout kind of like we have some our accounts that we get some of the addition. And then the May interim that with all of your support, you approved the $502,000 on the items, which is on the bottom left-hand side that I will walk through. As of yesterday, when we look at the actuals on the closing, and then the expected kind of like some of the budget relief from the incumbents, and then the GMEA salary catch-up that we will pay retroactive, that is where we see the kind of like the full year forecast to be. And then comparing to the budget on the round number, that's where we see a shortfall in the personnel service line. And then on the other major object code, on the 200, 300, 400, those will have additional budget balance that we will use it to cover the major object code 100. You see the fixed charge budget balance is 0, but we didn't spend all the budget, but given it is a capital, so we do not mix it with the operating expense. On the bottom left, you see the May interim budget that last month when I came in to ask for, we asked for $60,000 for the POS, $82,000 for the paper product, $250,000 for the food, and then $110,000 for the Greenwich High School orphans. We didn't spend all of the monies that you can see the balance in there. Particularly on the food, we were cautious to make sure that we are kind of like tightly managed the cost versus the lunch that we served. So that's where we have $75,000 saving on the food, and then it's about $2,600 not spending up to the budget that we asked for the paper product. And then when we try to look into understanding what happened on the salary line, I can point it all down to the temporary salaries. The temporary salaries are all the food service worker, which they are the part-time basis. When I look at now in the hindsight, the 2022-23 actuals, we spent $1.5 million on the temporary salary for 46.2 FTE. The average salary per FTE is $32,500. The budget put together for 23-24, it is assumed for $1.43 million on the temporary salary line for 44.3 FTE, which is on average a $32,300, which is even less than the actuals of the prior years. So I would just point this to kind of like a bad assumptions on the budgeting So that's where we find the issue on the salary line when we are closing the book.
Any questions? So if you look at this, where you're ending up now for the school lunch fund, for the fiscal year '24, does the budget look okay for fiscal year '25? I mean, food costs were an issue because of the, the audit and using the super healthy foods, so whatever words you used. And then also temporary help, or is the fact that you have a new head of this food services going to mean, a more watchful eye in terms of managing this? Or, can you just give us, how does this compare to just a quick, fiscal year '25?
On the '25 budget, I would say the potential exposure will be on the temporary salary lines to reflect the new salaries of the union contract. And then on the food costs, again, it's the same as last month I came in. Probably it's Harry, you asked me about if it is kind of like the implication to the food budget for the new school years. We are modeling kind of like the school lunch menu, the menu with the food and then the cost, to kind of like see what is the total pictures of the food cost. So that one is not giving up yet. So that one is not coming saying that it must have an exposures, but we are walking through the options available in the school lunch menu, and then the options available on the a la carte food, meaning kind of like the kids coming to buy muffin, pay for the muffin. And
Now that we
therefore
have a new oven to cook them in.
we will have kind of like the incomes for those items to kind of like offset on some of the costs. So that piece of work is not completed yet. It's still work in progress.
Okay, Mr. Pena?
Just a couple of a finer point on it. The two documents we put on the document in front of you, the fiscal year '24 budget and then the fiscal year '25 budget. What I want to point out is when you look at the temporary line item, that account 1,300, hindsight being what it is, one should not expect to see a 2.1% increase budget to budget when you have step or increment compounded with the GWI. So you see that it was relatively low, so that's just a finer point. As the year we're just closing, we misbudgeted some of the increment, which is why we're having the gap. It has been corrected when you flip the page to 2025. You see that same line item now has a growth of 13.4%. One would expect that wouldn't be that high, given the GWI plus increment is not that. But however, the base was not correct. So we believe we corrected for fiscal year '25, the year we just opened. However, Patrick just ran the numbers for exposure, just to put it out there, based on the GWI, particularly because the fifth step, so the top step for the food service workers, did not increase 2.3%, it increased 3%. That was not counted for when you built the budget in the fall of last year. So we're already entering the year, we're 8 days into the fiscal year, we're already projecting 51,000 budget gap based on the contract settlement. But the other point we're mentioning is now we are fully staffed. We have a full, the director has been vacant since November. Martha is now with us for several weeks. I purposely didn't bring her today because I go, let's just start the new year off on a better foot. But we certainly have the processes in place monthly, and we're adjusting our Board of Ed report as well. But I think we do anticipate 51 gap, all things being equal, going forward. And Patrick correctly stated the food cost remains a volatility.
Right. Harry?
Yeah, I would hope, I mean, this really puts us in somewhat of a difficult position, having this come to us this late. So I would hope that, in fiscal '25, this gets tracked better, and any additional appropriation, as this is, gets caught sooner. It's really important.
Leslie?
And I just want to go over the numbers, or point out the numbers, Patrick, that you indicated, which is you're short on operating by 54,000, but you have, you will not be using 94,000 of capital that you've been appropriated.
It's not 94.
Oops, sorry, the wrong.
That will be 598 versus 542 on the top two tables. The revised budget 598 and the full year forecast 542. So I will not be using $56,000 of the capital.
56,000, but, so, thank you for refining the numbers, but that still covers the operating loss, if you will, that you didn't, that you're identifying now.
Yep.
Thanks.
So in other words, Leslie, you're saying, well, we have to see what the rest of it turns out, but it'll,
Right, so for their total fund, because they're a triple R fund, it's, it's not a negative impact at the
it's
bottom line.
basically flat.
It's flat. For those
So
two
that,
items.
that was a good point. But I think the question also is, you just weren't aware that this was going to happen when you visited last month?
Yes, I would think so.
Or was it 2 months ago?
This will be the kind of like a new observation after the May interim that we brought it on the table. So the May interim, we really kind of like address the issues on those areas. And then when we are closing the book now in June, we see the temporary salary having a kind of like a bad budgeting assumptions.
So I think at this point in time, based on this conversation and what I've heard from both of you, we just won't bring this to a vote. Okay, thank you. So we thank you very much for coming and doing the work. And I guess, is it, since we're not bringing it to a vote, there's no need to come or consider next Tuesday morning at 9 o'clock's meeting. Is that correct, Harry?
That's
Nope.
correct.
So,
I mean, basically, this is just an overdraft.
And thank you. We appreciate the consideration of not attending another meeting, but thank you.
Thank you very much. Okay, so, I'm sorry, now we get to the fact that that we're early in the month and therefore there isn't an economic conditions report, correct?
That's correct.
And any preview or anything that we can think about? Oh, I'm sorry. Could have taken that one too.
Yeah, I think, we're looking at where we think we're going to be at the end of the year, and or at least break even, right, Pete?
Breaking even fund balance on the general fund.
Yeah, a little bit above break even. So far, so.
Good.
Pretty good. The other funds, they all look pretty good, except for the Nathaniel Witherall, but the revenues were good. We ended up with way over 9 million in interest income. Conveyance good. Well, you see the big three every month: the interest income, the building permits, and the conveyance tax. We didn't get any real large lot SIPs or low SIP monies this year. We did the low SIP. We did get 461,000. We were shorted on the sped money. We over budgeted. We were short about 300,000.
You probably should, it's too bad that they weren't still here when you commented on that.
I know.
Where do you think schools come out overall? Because I know there was some talk that they would,
How much they return?
how much they would return to us.
But
It
no,
was-
they have a deficit. They have a deficit every year. It's a misnomer when they say they return money. They had an additional appropriation of over $2 million.
Right.
So the money they're referring to is the money after the additional appropriation. Now, Ben had told me they were going to return $1.4 million 2 months ago, but Roland, you said that we're coming down. It's a lot less. It's less than 500,000.
Less than 500,000.
Yeah.
As an example, I think we
Okay.
approved $2.2 million in December, didn't we?
That's what I'm saying.
Yeah.
Technically, they're not returning any money. They're returning the excess.
Of the additional appropriations.
Yeah.
I get it. Thank you.
So, good, thank you. So I guess we're early, and you'll send the report when it's available, Roland, as you usually do, and the additional comments. We have 2 sets of minutes. Are we ready to approve these? I sent them through, I
well,
accepted all your comments, I accepted,
So the one set of minutes,
well, let's talk about May. Do I have a motion to approve the May 14th, 2024 meeting minutes? Okay, moved by Harry.
and I'll second it, but I have a question because I have to go back. David's comments were on the June minutes or not on the May minutes, is that correct?
He had some comments on the May minutes. I think I incorporated them, Leslie. I mean, we can, if you want to discuss, since he isn't here, it's,
I just want to
Wait a second now.
understand what happened after his comments. That's all.
well, let me just go back so we can understand them. Let's see if I can pull them up here. Okay, so he asked,
You're right.
PW6, he added, it was noted that a federal grant of $400,000 would be available. That was in all of I did not make this change. It was in all of, the documents and so forth. I didn't think it was necessary to make that long addition. The next one said there was.
Unfortunate, I do like to see what's changed in minutes and be able to review what's there, and I have not
I think
seen
there's
the
a hard copy
revisions.
right in front of you.
Well, you want to sit here while I do the work to figure it out?
Well, I'm saying, the first point, there was no changes. We're talking about May minutes. You had no changes, so I've made no proposed changes, so I made no proposed changes for you. Now he's on PW6.
Well, if you want me to catch up, you got to let me catch up. I'm pulling up his emails.
I mean, it'd just be nice to get them out of the way before the summer begins,
I understand.
so that we start the fall.
And I know that we talked about, and this is not your issue at all, but we talked about needing to circulate these as early as we can.
So again, you had no comments, so there's the good news.
I was taking a light, put my pen down when I was reading it on purpose. No, I disagree. I think that his comment to indicate that there would be a,
So where are we now? We're in
this
PW?
is PW6, and to add the comment that it was noted that without the grant, our town's ability to apply for grants would be impacted.
No,
negatively
you don't need to have that grant in order to do an action plan, okay? And you can also apply later on. If you want to say
It said
that
would
we were awarded
jeopardize- It would jeopardize
No,
eligibility.
we can
His
just say,
language is correct.
no, it does not. That's not a correct statement, Leslie. It means you still have to do a plan, whether you have the grant or not, if you want the other ones, the follow-on. So, if our department chose to do the plan, they wouldn't need the grant. We're very fortunate we have a $400,000 grant. If you,
I mean,
and say,
Would need to
we can say the
self-fund.
grant totaled, after the first sentence, the grant totaled $400,000, because it's a bit misleading.
the minutes we have say 500. Was it 400?
The grant is $400,000.
Was her request 500?
It says Yes, her request is 500,000. It's an 80% grant.
Got it.
It's a reimbursement grant.
Sorry,
So
it's 2
I'm
months ago.
happy to say that Ms. Brew presented the request for a $500 additional appropriation for the Transportation Safety Action Plan grant. The grant totaled $400,000. Make additional sentence after that. I'm happy to make that
The
statement.
point is not that,
Well, the point is erroneous. It's the fact, if you want to mention the grant, happy to
if-
mention it.
you know, we can't, to edit on the fly is really difficult.
I know, these are
So
his comments.
These are his comments.
Not my comments, not your comments.
Correct. So that, so if you accept his comments, which you're not accepting his comments, these minutes aren't approved. So we can't approve these minutes because
Well, because his comment isn't
we can have,
correct.
why don't we do it this week, have a 5-minute special meeting before 9 a.m. next Tuesday, and we can approve them Tuesday.
Mr. Fisher, is that okay with you?
CMS Building Committee at 8.
A 5-minute meeting after the 9 o'clock BET meeting.
Oh, a 5 o'clock.
No, sorry, a 5-minute budget committee meeting when we conclude the,
Oh, that's fine with me.
When is it going to be?
It would be after the regular BET meeting.
how do we post that?
How
when
do we
don't know
post
the
that?
time?
How do we post that, Peter Rowland, if we want to have a very short meeting? Well, we can just say post a budget committee meeting immediately following the,
Yeah,
yeah, special meeting.
You can post that.
right.
No, I was just thinking the posting has to start at 10 o'clock or 11 o'clock. We don't know what time it's
Oh.
going to start.
We can say,
But if
we can
say immediately
estimate.
after.
We can estimate based on, well, we had Witherall, so we'll let Harry estimate, and we'll say estimated, but immediately following. And we've done that on other things, haven't we, Roland?
Yeah,
Yep,
immediately
And it's-
following estimated 10 o'clock.
yeah.
Okay. All
So
right.
does this mean
that
we're not going to do any more of the rest of them, or do I point out that
Well,
I've
we'll do
accepted
both
them?
May and June. at
Did
that
you,
meeting.
yeah, because I don't know if you didn't accept David's comments, but.
Only that
what-
one. Most of the comments I did accept.
But he has one in June. But why don't we do them both next Tuesday?
Okay, so we're going to hold a special meeting next Tuesday. So let me just comment here that on something else, and of course now I pulled something up because of our other meeting. So the bottom line, I can't pull it up now, we can mention it at the special meeting. In our chair report, I just wanted to report that Samantha has put together a PDF chart for requested appropriations, which should make it easier for the departments to fill in the form. There've been some issues in the departments filling the form and, parts being held there. I think, Roland, you raised a point, you want to make sure that everything balances and so forth, and so I don't know whether you've checked out the formulas on that, but that's upcoming, and that will be available for our September Budget Committee meeting, maybe, hopefully. So we have that, and then the other thing is, we did send out a memo to all departments about 10 days ago or 2 weeks ago, and asked them to please get their requests for appropriations in earlier, that we really want to get them in on the Wednesday prior to the Budget Committee meeting. And so this is a plea for, to help us organize these meetings and to get our information earlier, which I think we've all been wanting to have accomplished. I know Harry sent out something much earlier in the year that didn't seem to work. I must say it did work for this agenda. We asked that everything be in no later than last Tuesday, and that seemed to work for this particular agenda, or almost, with the school lunch. So, and of course, Nathaniel Witherall didn't submit anything, so we just discussed it.
Yeah, that makes sense, and I think what probably helps is Samantha sending an email reminder.
Yep. Okay.
Seemed to help this time, so.
Right, I think I
Let's make
wrote,
that
I
a
think I
regular-
wrote it. I think I wrote it, but anyway,
But it
and
came from
Samantha said,
But
so
I
we
think that helps to have it front and center in
so I
all
think,
the department heads.
actually,
And then if we actually do hold to our deadline and reject things that are late, that will get some more attention.
Well, I don't know how much tension, I'm going to need the health department, I'm sorry?
The yoga training for de-stressing.
Whatever program it is for de-stressing, I may need it, but if we say no, total no. But I do think that, the point area is a good one. Maybe we'll send out the reminder towards the end of August or around Labor Day. Rewrite it for September and for the fall, so to remind people to get ready and to make sure they meet the deadlines.
Of course, we don't want to encourage hindrance.
So, yeah, exactly. There's a good one. We don't intend to hear from you at all, but just in case you do want to get on the agenda,
Can I make a motion to adjourn?
of course,
Motion to adjourn.
at 2:48 by Leslie Moriarty, seconded by Harry Fisher. All in favor, aye. So vote is 3-0-0. So thank you very much, and we will have a brief meeting next Tuesday morning.